Hello and welcome to the Medic's Guide. Today we're going to cover Guillain-Barré syndrome, so as always grab your pen and paper and let's get started. So GBS describes an immune-mediated demyelination of the peripheral nervous system, where the majority of cases are actually triggered by infections stimulating these anti-ganglioside antibodies, and these antibodies then attack the myelin sheath of the peripheral nerves. Now we'll go into this in a bit more detail, but first, this condition mainly affects people around the age of 20 to 50, and it's quite a rare condition with only a few cases per 100,000 of the population. However, despite that, it's actually the most common cause of sudden onset flaccid paralysis in the developed world. Now, many infections have actually been linked with GBS. The most common are gastrointestinal and respiratory illnesses. Now, this is important because up to 70% of patients with GBS have actually reported some sort of illness in the 1 to 6 weeks before their presentation. Now, some of the infections most commonly associated with GBS, like Campylobacter jejuni, are known to share structural similarities with the components of peripheral nerves. Now, the actual capsule itself of Campylobacter jejuni have antigens that are very similar to parts of the axons and myelin of neurons, and these parts of the neurons are called gangliosides. Now, when you get an infection, your body produces antibodies as a result of the activation of the immune response. And these antibodies are actually really important in tackling infections like Campylobacter. But what these antibodies will also do is then cross-react with the gangliosides because they have such similar structures, resulting in nerve damage. The characteristic features of GBS is progressive weakness of all four limbs. Now, this weakness is classically ascending, so the lower extremities, the feet and the legs are affected first, and then this moves upwards. And this can progress quite quickly, sometimes even hours, but in other patients can be days or weeks. Reflexes are usually reduced or absent, and sensory symptoms tend to be quite mild, so things like numbness, paresthesia, they generally are quite mild. And as I've written, around 65% of patients will experience some sort of pain, and this could be leg pain or back pain, and this is usually in the initial phase of the disease. Now, in terms of the other features, as we mentioned earlier, there may be a history of gastrointestinal or respiratory illness. Now, what can happen is the phrenic nerve can get involved, and if that does, it can lead to respiratory inadequacy and a lot of breathing difficulties for the patient. And if this does happen, it's a sign of quite a severe illness as well. The cranial nerves can also be involved, leading to things like diplopia, double vision, and the autonomic nervous system can be affected, leading to things like urinary retention arrhythmias and hypertension, as I've written. Now, a way that I remember this and just how this condition is affected or progresses is through toes to nose. And that just tells me that it's going to start quite distally in the extremities, the feet and the legs, and then move in an ascending pattern upwards. And that just helps me to remember it. Now, in terms of investigations, a lumbar puncture should always be done first, and what that will show you is an isolated rise in protein, and you'll notice that the white cell counts are normal. Antiganglioside antibodies are usually tested in GBS, but their absence doesn't exclude the diagnosis, so bear that in mind. And you can also do nerve conduction studies, and because the myelin sheath is affected, it will show slow conduction, and this is just to help distinguish between other conditions as well. Routine blood tests should also be done, and things like creatine kinase and immunoglobulin levels should be tested, and that's because it can exclude other causes of weakness and also reduce the risk of immunoglobulins, which is part of the treatment. And in renal failure, immunoglobulins are relatively contraindicated, so it's just for that really. Monitoring the vital capacity is really important, as we mentioned about the phrenic nerve and respiratory problems, and ECGs for any arrhythmias that come about. In terms of the treatment, as I mentioned, intravenous immunoglobulins are given, but you can also do plasmapheresis, which is basically a blood transfusion. You can do one or the other, and usually they are the first line treatments. An important thing to know is that steroids are not really helpful in the treatment of GBS, so we avoid them. Now, there are a number of other things that we do when managing GBS patients, and as I mentioned, 65% of these patients will have pain, so we need to give something to help them with that. Now, because this is neuropathic pain, things like paracetamol and ibuprofen don't really work that well, so we need to give a neuropathic pain agent Something like gabapentin does work well. This you can give different drugs. It just depends on where you are in the world and which hospital you're in. But generally, neuropathic pain agents are given. Now, if the phrenic nerve is involved, then sometimes these patients will have really difficulty in breathing and may need ventilation. And if certain nerves are affected that maybe affect swallowing, then we do sometimes give IV antibiotics to avoid complications like aspiration pneumonia. And lastly, as these patients generally are unable to move because of their weakness, they will require some sort of anticoagulation. So just to end things off, a couple questions as always. A 26-year-old female presents to her GP with a 5-day history of worsening weakness in the lower limbs bilaterally. She also describes a pins and needles sensation in her feet. She has a history of depression but otherwise no past medical history of note, other than having an episode of diarrhea 2 weeks ago. On examination, she has reduced tone and reflexes in her legs, and power is 4 out of 5 in the lower limbs. What is the most underlying diagnosis? Now, as you can imagine, the answer is GBS, but let's look at this question. So we've got a 26-year-old in that 20 to 50 range, so that gives you an idea already. And we've got this bilateral lower limb weakness, which is worsening as well. So that really is the pattern for GBS. Now, the main important thing to note is that this history of diarrhea 2 weeks ago, and that could indicate this gastrointestinal infection that really is linked with this condition. And we can see that there is some weakness with the reduced power as well. So that's the answer, GBS. And the last question, a 43-year-old woman presents to the ED with a tingling sensation in the hands and feet and some difficulty swallowing. That had started 12 hours previously. Examination showed reduced ankle jerk reflexes and 4 out of 5 power on plantar flexion bilaterally, but was otherwise normal. And we've got the lumbar puncture findings here as well, with a blood glucose as well. Now, let's look at these lumbar punctures. So we've got the colour, which is clear. We've got a normal glucose. Now we've got a protein which is quite high. It should be less than 0.4 here, it's saying, but we've got one that is 4, so that's quite high. And the white cells seem normal. Now, this is again GBS, as you can imagine. We've got again a 20 to 50-year-old is the range. So we've got a 43-year-old woman, again, very common. And we've got some maybe tingling sensation. We don't really know what that is, but we do have some difficulty swallowing. We've got some reduced reflexes and weakness, and this is bilateral as well. And we've got this isolated raised protein in the lumbar puncture, and that really gives you a good idea that this is GBS. Anyway, that's all I've got for you today. Thank you very much if you made it this far and watched the whole video. Please like, comment and subscribe, support the channel, and if you want me to cover a specific condition, just let me know, and I'll be back with another video soon.